Hello, my name is Tamar Mizrahi, and I'm going to present you our study of probing high-level cognitive processing of frontal lobes using fNIRS and naturalistic stimuli. Disorders of consciousness is a devastating condition, and detecting consciousness in these patients has great practical and ethical implications. Various methods have been used, but they all have pros and cons. Here we tested whether naturalistic stimuli and fNIRS of the frontal lobes can be a potential diagnosis approach. Naturalistic stimuli have been used extensively in basic research and recently have been proposed for diagnosis of patients with disorders of consciousness. The idea is that if patient can track the context of naturalistic stimulus, for example, a movie clock, then he or she is probably conscious, at least for some level. fNIRS is a particularly well-suited tool because it can be used for bedside testing. Our study included 24 healthy participants. The participants listened passively to 4 naturalistic stimuli of 9 minutes each: story, scrambled story, classical music, and scrambled classical music. During the listening, brain activity in the frontal lobes was recorded by fNIRS, with 4 channels in each side, as shown in the figure. We applied leave one out inter-subject correlation between subjects on the deoxy and oxyhemoglobin recorded values. The analysis was conducted both at group level and the level of individual subject, the type of analysis which is particularly important for the future individual patient diagnosis. The results were as following. For the story versus scrambled story, in both the oxy and deoxyhemoglobin values, we got a very significant main effect of condition, indicated the difference between the intact and scrambled versions of the story. Post-hoc t-test also established individual channels in which inter-subject correlation was significantly higher in the story. We applied bootstrapping in order to assess the effect at the individual level. The effect was shown in 75% of cases in both the oxy and deoxy channels. For music, there was no reliable effect between conditions. Only in 2 channels was the difference, while only 1 after the multiple comparison correction. So to sum up, we have demonstrated in this study with fNIRS the naturalistic stimuli that the frontal lobes have been involved in processing of meaningful auditory narratives, but not in processing of music. Thus, we suggest that this method can be used as a new paradigm to detect the consciousness level of patients at bedside and potentially improve diagnostic accuracy.